Hello, you are most welcome, ladies and gentlemen, to Real Impartation Moment on Tuesday Night Anatomy with Daniel Okwan. Today's section, I begin with you the integumentary system. And this is going to be the first part, which I've tagged the skin introduction. And so, without much ado, let's set the ball rolling and look at what I have for you. Now, get to know that the word integument has to do with covering, and therefore, the important component as far as the integumentary system is concerned will be the skin. Okay, which of course we know that the skin is the largest organ of the human body. Yes, as far as the human body is concerned, the largest organ. And because it's quite heavier, it's going to occupy about 12 to 15% of the entire weight of the human body. And then again, it will also cover an area of about 1 to 2 meters as far as the surface of the human body is concerned. But we get to know that yes, it's not only the skin which is an important component of this integumentary system, but of course we will see the hair, we will see the various glands, sweat glands, and of course the sebaceous glands. You will see those ones. So there we are. Now if we talk about actually the integumentary system, then as I said, it will be made up of what we call skin. So there's a skin quite thick, occupying roughly 12 to 15% of the weight of an individual. Then apart from the skin, we also have some derivatives which will come from the skin, or some appendages which will be coming from the skin. And these ones we include, of course, the hair. Yes, we also see the sweat glands as well. We also see what we call the sebaceous glands. These are going to be important appendages of the skin. Now, in some other animals, you may see fur, hooves, and what have you. Yes, I'll be taking you through that one. So these are the derivatives that we get from the skin. Now, remember, these derivatives are actually coming from, the epidermis, but they grow towards what we call the dermis. Now, we've looked at epithelial tissues, we look at connective tissue. If we talk about skin is actually made up of two components. An epithelial component, which is known as the epidermis. Okay, epi means above, epidermis, okay, which of course is made up of stratified, squamous, keratinized epithelium. We are going to see these things, which will usually be made up of 4 up to about 5 layers. Okay, we see that. And then of course we look at the dermis, which is made up of 2 layers, namely the papillary layer and of course reticular layer. We are going to see them. That is the dermis. Now, we said that by way of principle, we said that epithelial tissues are avascular. And because they are avascular, similarly, the epidermis will be avascular, will be devoid of blood vessels. So if you cut through the skin, okay, and no blood comes out, then it means the blade or the sharp object was confined only to the epidermis. But once you see blood coming out, then it means you've gone to the dermis. Because in the dermis, beneath this epithelial layer, which is the epidermis, we should have what we call the connective tissue. Because in the connective tissue, we have a lot of blood vessels in there. So that, of course, through diffusion across the basement membrane, the epidermis could also get its nourishment. So these are, the various things that you have to know. Now, I told you that the epidermis will have 4 or 5 layers. Usually for thin skin, you have 4 layers, and then for thick skin, constant, you have 5 layers. And the 5th layer will be the stratum lucidum, which you will see. Now, one thing is that this is the dermis, which is the connective tissue component. It's made up of, the papillary layer. And that is why, just away from the epidermis, you can see the connective tissue will be moving into the, epithelium, and that is what we call connective tissue papilla. And therefore the dermis, the layer of the derm which is immediately below the epithelium, is known as the papillary layer. Then deep to the papillary layer, now this papillary layer is actually made up of loose connective tissue, areola, and deep to that one will be a layer of dense irregular connective tissue, and that's what we call the papillary layer, the reticular layer. And this reticular layer, don't be confused, we are calling it reticular layer. It doesn't mean that it's going to have this kind of reticular connective tissue, but it will be made up of dense irregular connective tissue, a lot of collagen fibers running in different directions, little ground substance. I'm going to show you that. Then apart from that, yes, we will see some kind of we will see the various cells that we find in the epidermis, mainly keratinocytes will be there, some melanocytes, some Merkel cells, and of course, Langerhans cells will also be seen there. They will have various functions that they will play. Now, in the dermis, we said that all the derivatives by way of the hair, by way of the sebaceous glands, by way of the the sweat glands. Now for sweat glands, you get to know that I have apocrine sweat glands and of course eccrine sweat glands. I'll show you that one. For apocrine sweat glands, they tend to go downwards. Okay, they grow downwards towards, usually towards what we call the hypodermis region. And of course, sebaceous glands will usually be confined to, of course, the dermis. But usually, if they grow downwards, towards or very close, or into what we call the hypodermis of adipose tissue, then of course that one becomes what we call the apocrine sweat glands. And usually, apocrine sweat glands, they tend to open into, of course, the hair follicles. I will show you that. So that is what we are going to see. Apart from that, we see some other, encapsulated, nerve endings, or nervous tissue over there, like this one, which is having this kind of as if you slice an onion. This is known as the Pacinian corpuscle. You see all those ones, these are Pacinian corpuscles. And then of course you also have what we call Meissner's corpuscles, which are very close to what we call the papillary layer. Around where we have the papillary layer, we are going to see those ones. And of course, as well as some free nerve endings, which of course will contain some kind of nociceptors, okay, trying to detect pain and all that. So of course, touch for Meissner's, Pacinian, okay, you might think it's pain. No, Pacinian is for pressure. So we're going to see those ones. Okay, so these are the various components of what we call the appendicular skeleton, which we'll be looking at. But one thing that I have to make it clear is that beneath the dermis is, of course, the hypodermis. And this hypodermis can also be called the subcutaneous tissue, because it's yes below, because cutaneous membrane, yes, is the integument, is the skin, and skin is made up of epidermis and dermis. So beneath the integument is the subcutaneous layer, or the hypodermis region, and that portion is what we call the superficial fascia. So if you hear superficial fascia, it's mainly that component where it's beneath the skin, and it's usually fatty, made up of adipose tissue, a lot of fat cells in there. So technically, hypodermis is not part of the skin. So let's actually move on. Now we also see something that's associated with the hair follicle, so that upon contraction, it will cause the hair shaft to stand erect, okay, or to be vertical or perpendicular to the skin, okay, to trap a layer of air serving as an insulating material so that heat loss will be minimized, okay, through conduction. And this is what we call the erector pili muscle. So this erector pili muscle, or the erector muscle, yes, is often associated with, of course, the hair follicle. They're associated with the hair follicles. Now I said that sebaceous glands will also be there, okay. Some of them are associated with the hair follicle, others are not associated with the hair follicle, so they will open directly onto the surface of the skin. But those ones which are associated with the hair follicles, yes, upon opening, yes, they will help to moisturize and of course lubricate, so to speak, the hair shaft, or make the hair that kind of moist or shiny, so to speak, so that it doesn't become what we call dry, so to speak. So these are the various things that we have to know. So as I said, these are blood vessels. Also in the hypodermis you have blood vessels, and they will extend into the dermis, the papillary layer, then eventually into, of course, into the reticular layer, then into, of course, the reticular layer, where they form this hairpin-like, appearance, okay, so that they can nourish, the epidermis. All right, so having seen the skin, then let's look at it. Now, what are the various functions that the skin is performing? Yes, why is the skin really very important? Now, classically, the skin is performing three main functions, and one important one is going to be protective, so function of protection, so that it can protect underlying structures, and that protection mainly is coming because of course, the epidermis having this kind of stratified squamous keratinized epithelium, okay, very protective, very important component of the innate immune system. Apart from that, even the sweat, the sebaceous, the sebum that is secreted, all these chemicals in there may be, bacteriostatic or bactericidal, so that in a way, yes, it's performing that function of protection. There will be immune cells. We'll get to know Langerhans cells, okay, macrophage cells of the skin. All these ones will also be very important. The dermis will contain, cells of the immune system or of the blood, which are very important in combating, infections. White blood cells, notably talk about mast cells, talk about, talk about eosinophils, neutrophils, and what have you. All these ones will also be there. And so the function of protection is very important. That's a key important function of the skin. Now, the second function is to excrete waste product of metabolism, which will mainly contain, these kind of salts, these organic waste, nitrogenous waste actually. Then, of course, some excess water will also be excreted. Okay, yes, because we know we're going to have these kind of sweat glands in there, whether it be apocrine or merocrine sweat glands. We will see that. Then the third main function, yes, will be the function of sensation. Okay, so detecting certain things like touch, pain, temperature, pressure, and what have you. Yes, these functions will be mainly performed, by the skin. Sensation. But there are some auxiliary functions that, of course, the skin is going to play, because the skin will contain certain cells we call them melanocytes, and they will secrete what we call melanin, okay, which is very important skin pigment. Yes, not only melanin, gives pigmentation to the skin, but also, some kind of keratin, okay, which may be converted to vitamin A. And then apart from that, production of keratin, and keratin is very important in conferring this kind of protection. Yes, that is why the skin is keratinized. Mainly, very important for protection. Then, apart from that, it will also be important in the synthesis of course, vitamin D. But this vitamin D, which is synthesized, will be inactive. Now, that is why I always say that we don't get vitamin D from the sun. Yes, vitamin D is actually produced in the skin, but what happens is that, yes, using what we call cholesterol. So cholesterol will be converted to vitamin D, but that's the inactive form. Okay, but we need the UV light from the sun to augment this kind of reaction in the skin. Okay, so that's very important, because of course, after we produce the vitamin D, it has to be activated, okay, with the help of the liver and of course the kidney, so that we get 1,25-dihydroxycholecalciferol. Okay, very important in absorption of calcium in diet. So vitamin D is made in the skin, not coming from the sun. Then, of course, some storage of some lipids, because we know that beneath the skin there will be, of course, this kind of adipose, tissue in there. So these are some important bits as far as, the functions of the skin, are concerned. Now, having seen that, then, yes, I want to look at the interrelationship. Now, these, we said that anatomy is very important, because, these systems of the body, for instance, the integumentary system is not in isolation, but it's going to work in unison with other, systems of the body, so that, yes, you become a complete, individuals. You become sound as far as the various functions of your body, are concerned. And so we want to look at the interrelationship that it has with other systems of the body, begin with, of course, the skeletal system. So while the skeletal system will be very important in giving the structural, support, okay? Yes, so it's giving more or less like the framework upon which the skin will be, tied to, okay? So the various skin, contours that you see, the various bony prominences may influence the nature in which the skin will be. So it means that it's providing that kind of structural support. Now, in turn, we've already seen that vitamin D will be synthesized by the skin, and when it gets activated, will help in, of course, calcium and, of course, phosphorus absorption, okay, to maintain this kind of normal homeostasis, so to speak, in the bone. Okay, so bone calcium, yes, will be very important for that absorption, and that one is coming from the skin. Again, the muscular system, by way of the muscles, yes, will be very important. For us, we know that associated with the hair will be, of course, the the erector pili muscle, so that upon contraction it will pull, of course, it will help make the hair shaft erect, so that it can trap a layer of air. Apart from that, yes, even the skeletal muscles over there, upon contraction, for instance, my facial expression muscles, yes, I can produce various facial expressions, okay, so that I can do that kind of non-verbal communication. Now, apart from that, the skin will also be synthesizing vitamin D, as we've said, and this vitamin D will be very important in contraction of the muscle. Then, in the nervous system, yes, by way of controlling blood flow, and of course, by way of controlling blood flow, yes, it will also, control what we call the activity of, regulate the temperature of the body, actually. Then, of course, and sweat glands, okay, they are going to regulate them, okay, by way of the nervous system, so that they kind of regulate the temperature of the body, thermoregulation. Okay, so that is what, we've seen. And then upon contraction again, of course, the smooth muscles, the erector pili muscles, upon stimulated, okay, by the nervous system, autonomic nervous system, because they're actually smooth muscle, they are involuntary muscles, they will help in contraction and of course elevation of what we call the erector pili muscle. Then likewise, on the other way, what happens is that in the skin, actually in the dermis and then the deep part of the epidermis, they provide that kind of sensations to touch, pressure, vibration, temperature, and pain. Because we said that we are going to have free nerve endings, you have what you call Pacinian corpuscles, you have Meissner's corpuscles, Merkel disc, all these ones will be there so that they can actually help, augment the function of the nervous system. But not only that, even the nervous system, endocrine system, being one of the components of the coordination system, just like the nervous system, these ones will produce hormones, okay, to stimulate, of course, the sebaceous gland activity. Yes, I mean, for instance, these sex hormones will do that, and they also, influence, male and female sex hormones will influence that kind of growth that we are talking about, even accumulation of adipose tissue in the skin. Then, of course, the activity of the apocrine sweat glands. Because we know that even during sexual intercourse, the apocrine sweat glands, yes, their activity increases so that they make a lot of sweat. Of course, in the armpit, in the back area, getting the gluteal region. Yes, these areas, okay, sweat glands that will be coming from these ones, apocrine sweat glands. Then apart from that, even the adrenal gland will be making these kind of hormones, okay, which will be very important in mobilization of what we call fat. And I don't need to tell you that we've done the endocrine system, yes, histology. So please, you can go and visit that video. Yes, I mean the the glucocorticoids, okay, in the zona fasciculata, yes, will be very important in metabolism of what we call carbohydrate, protein, of course, lipids. So you have to know that. And then it's also going to further, vitamin D, which is made by the skin, will be very important components, okay, of what we call the endocrine system, regulating various physiological activities as far as calcium metabolism is concerned. Then in the cardiovascular system, yes, the cardiovascular system, oxygen and nutrients, okay, as well as hormones, what have you, waste will be carried away from the skin and what have you. So these are what we call the things that, of course, the cardiovascular system will be helping the skin. But apart from that, they also help in that kind of regulation of temperature, because of course, as blood will be flowing through the skin, yes, then of course, we kind of minimize what we call heat inside the body. But as vasoconstriction takes place, then of course less blood is coming out. So please, these are the various things that you have to know. Then apart from that, what is happening, the skin in turn, through the production of what we call mast cells, degranulation, they are granules released, okay, containing histamine, will cause what we call vasodilatation, okay, increasing permeability of capillaries, okay. So these are certain things which are very important the skin is doing. Even for the excretory system, yes, the excretory system, what we find is that they are going to help remove waste products, yes, maintain normal pH of blood as well as body fluids. Yes, waste product will be taken out. Yes, waste from the skin out will also be taken out. But in turn, what is happening is that this integumentary system by way of skin is also doing some assistance in the excretion by way of, yes, removing this kind of waste from the body and all that. But the keratinized epidermis, which you've seen, will be very important in limiting fluid loss. Yes, these are the various important that the skin is going to do for the urinary system. But in the reproductive system, we are saying that these sex hormones that we've talked about, yes, being the testosterone, estrogens, mainly estradiol, okay, will be very important in the distribution of adipose tissue in the subcutaneous layer of the skin. But apart from that, even estrogen will be very important in development of what we call the mammary glands. That's the breast. And we know that the breast is a modified apocrine sweat gland. That's what you should know. So the breast is actually coming from the skin. Then again, in turn, the skin will also be very important, in covering what we call the external, being very important component of the external genitalia. Okay, so we will see, yes, labia majora, the actual skin, mons pubis, yes, these are actual skin, scrotal sac, mainly the actual skin. So they provide that kind of sensation that stimulates what we call sexual, behavior. Yes, these are very true. Then of course, mammary glands secrete what we call nourishment to support, the fetus. So although the mammary glands, yes, is going to be, its development is going to come from the sex hormones, estrogens. What is happening is that after it has been developed, it will also serve some kind of reproductive function by way of nourishing the newborn. Now, other things that we also find is that, for instance, the digestive system will provide that kind of nutrients, okay, for, of course, the cells of the skin. And also some adipose tissue will be stored in the, hypodermis of the skin. But in turn, vitamin D, which is made by the skin, will help, of course, absorption of calcium and phosphorus. The digestive system is supposed to absorb, apart from digestion, it's supposed to help absorb this kind of nutrients. But what is happening is that calcium absorption will be maximally absorbed in the presence of the active, vitamin D. So that's what you should know. Then for the respiratory system, yes, by way of giving, oxygen, and of course eliminating carbon dioxide from these cells, yes, in turn the skin will also guard, the entrance into, of course, the nasal cavity. By way of the vibrissae, those kind of hair-like cells, the way of cilia in there will be able to do that. So these are the interrelationship that, of course, the integumentary system have with other systems of the body. But what do we find? Apart from that, even the lymphatic system is playing some kind of role. Now, what the lymphatic system is doing is that going to assist, okay, in the defense of the integument by way of the skin by providing what we call additional macrophages. We said that the macrophages of the skin, they are the Langerhans cells, as well as mobilizing some kind of lymphocyte in the dermis, for instance. That one will be coming from, of course, the lymphatic system or the lymphoid system. But what we find is that the skin will be very important component of the innate immune system, warding off what we call entry of pathogens in there. Then apart from that, yes, mast cells, which will be triggered, will cause, this kind of inflammation, cause vasodilation and all that, degranulation, and to initiate what we call an immune response. So by in turn, the skin or the integument is also supporting what we call the lymphatic system. So these are very important bits that we have to know. But the skin is actually very important. Yes, why? Because it can help us in the various diagnosis of certain, conditions. Because what we find on the skin may reflect what is actually happening inside the human body or some other organs. So for instance, when there's cyanosis, and cyanosis, has to do with blue. When there's bluish, skin, then it denotes low oxygenation or poor oxygenation, or hematosis, yes, and for that matter, hematosis of what we call hemoglobin. So there's poor oxygenation, yes, of what we call the hemoglobin, then it will lead to bluish nature of the skin. Usually we tend to see it in individual with light skin, okay, so those ones with light skin, okay, or the white, you tend to see that if there's cyanosis, it becomes very clear. Then the next one is erythema, and that is redness, rubor. So when there's redness, it suggests, of course, fever, hypertension, inflammation, some kind of allergies in there. Okay, so that one we can see. Then when there's pallor, otherwise known as blanking, yes, when there's pallor, then what will happen is that it's highly suggestive of anemia, whether it's iron deficiency anemia or whatever, then that is anemia. And that one is also suggestive of low blood pressure, fear, and of course, anger. Apart from that, we also have what we call jaundice, and jaundice, is by way of metabolism or bilirubin disorder, and that's one is actually taking place in the liver. So when the liver disorder, then it manifests on the skin as yellowing, coloration, and that is what we call jaundice. Now, this one is known as bronzing. Now, in bronzing, it's actually very important because we tend to see it in what we call adrenocortisolism. And that is what we call Addison's disease. Okay, so that one, we tend to see this kind of golden color, okay, that we see on the skin. And that one is highly suggestive of hypoadrenocortisolism, and that's Addison's, disease. Then we also have some kind of bruises or contusion. Now, that one, we tend to see it when there's, let's say there's an injury to the skin and it causes clots of blood to form beneath the skin, and that's what we call that kind of bruises that we find over there. So the skin is actually very important in certain diagnosis. Even apart from that, there are certain things which are very clear, like acne, and that one usually tends to happen to individuals at their adolescent age. So post pubertal age, we tend to see, because of a lot of what we call sebaceous gland activity, secreting what we call sebum, this kind of oily substance, then we tend to see this kind of acne over there, that kind of inflammation, local inflammation that we see over there. Then furuncle like the boil, which will be inflammation of the hair follicle. Okay, for instance, if you have an infection like Staphylococcus aureus infection, then it could lead to some kind of boils. Okay, they also have what you call psoriasis. And for psoriasis, what is happening is that there is increased what we call skin cell production, a lot of hyperplasia, hyperplastic, activity actually taking place in the skin. And when that happens, it results in what we call scaly skin, okay, which appears red, swollen, and of course warm. And that one, it tends to be, dry and of course itchy. So that's what we call psoriasis. Then we also tend to see something like vitiligo, and vitiligo is hypopigmentation, such that yes, melanin production is actually diminished, okay, because of autoimmune destruction of melanocytes by an individual's own immune system, vitiligo, and it's happening in about 1% of the population. You may tend to see it. Now, this albinism, which is, inherited in an autosomal recessive manner, yes, could lead to hypopigmentation. Yeah, not in fact, absence. So no melanin is actually produced at all. So we tend to see, no pigmentation actually in the eye, even in the hair, the skin as well. But in vitiligo, you may see, some patches of melanin in some areas, but it's actually but this one in albinism is actually absence at all. Then we also have what you call melasma, and in melasma we see that kind of brownish, patches on both sides of the face, brownish patches on both sides of the face, and it's usually symmetrical, as I said, on both sides of the face. But we see it, in some pregnant women as well. That's what you call melasma. So these are some certain things that we can use. Okay, there are certain things which are so glaring. As far as you see an individual's face, you can tell you what the person is actually suffering from. Now, if we talk about the skin, that is the dermis, okay, mainly. So if we talk about dermatology, is the study of the skin, and that is why if you have any skin problem, you have to see a dermatologist. And one thing is that whenever we talk about dermatitis, specifically dermatitis, then we're talking about inflammation actually confined to the papillary layer, mainly the papillary layer. That's dermatitis. And it may be caused through some infection, some radiation, some chemical irritant, or even some kind of chemical like poison ivy, for instance. And then that one is characterized by some kind of itch and pain, okay? Because of course we know that in the skin we have a lot of these receptors in there. So whenever you have pain, very itchy, whatever to the skin, you have to see a dermatologist, for that kind of, investigations and possible treatment. So having seen that, one thing that we saw was that yes, from the epidermis you go to the dermis, and we saw that kind of loop-like, movement of what we call the dermis into the epidermis, and that was the papillary layer. So those things are what we call the dermal papillae, okay, related to the skin. Generally, we call them connective tissue papillae, but for the skin, because it's the skin, then we classify it as being dermal papillae. And that one will contain those kind of capillary loops, which will form that kind of hairpin-like, appearance. And I said that over there, you see those kind of, touch receptors or tactile receptors being the messiness corpuscles, which are encapsulated corpuscles over there. We also see some kind of free, nerve endings over there, which are actually nociceptors. They contain nociceptors to detect pain, mainly. Then we said that yes, if you move away from that, then we go to the epidermis. Now, one thing is we find is that in thick skin, when I talk about thick skin, I'm talking about those areas in your palm, the skin in your palm, the skin in the sole of your foot. Yeah, they are thick skin. Okay. Above what you call these dermal papillae, we cause what we call epidermal ridges. So we tend to see these kind of epidermal ridges, or certain things we call them epithelial pecs. I'm going to show you that. And these ridges will be very important, okay, in what we call helping in gripping. Apart from that, also helping in some kind of sensation, and also giving that kind of fingerprint patterns. So these ones are actually the fingerprint patterns that we are able to produce. Okay, yes, it's actually coming from these epidermal ridges, or the epithelial pecs that we find over there. We will see that. So, having seen the skin, then what there are certain things when the skin is actually subject to some kind of stress, then it has to respond. And so we have that kind of adaptive response of the integumentary system, mainly the skin. So one thing is that formation of what you call calluses. So for instance, if you walk on your barefoot for quite a long time, or other things like if you pound a lot of fufu or do a lot of activities which of course you are using your palm or your feet quite frequently, okay, to rough areas, then what will happen is that by way of your skin, okay, helping to protect the underlying structures from damage, it will form these kind of calluses, okay, over there in the skin. So that's one thing. Apart from that, whenever you are exposed to too much sunlight, then what will happen is that your skin darkens, okay, your skin actually darkens, okay, and that one is very important because your skin, okay, or the melanin which is causing hyperpigmentation to your skin is trying to protect your skin, the deeper layers of skin from, damage, which when it becomes too much, it may lead to some kind of mutations. So it's preventing that. Again, during some kind of stress, during pregnancy, for instance, the fetus growth, and as well generally during growth, what happens is that your skin, tends to stretch, okay, apart instead of what you call tearing, okay, to expose the internal organs, it tends to stretch. That's also another, response that the skin is doing. Even apart from that, there are two kinds of stress. We have physical stress and of course emotional stress. For physical stress, then it will lead to what we call alopecia. Okay, so if there is, alopecia, such that yes, baldness, for instance, then it's going to lead to, because you are stressed. Okay, so especially males, when they become stressed, some kind of alopecia may take place. Even apart from that, graying of the hair will also happen. Then, with emotional stress, it will lead to what we call hirsutism, such that there will be increased growth of hair. Okay, when there's increased growth of hair, then that one, it tells you that you are emotionally, stressed. So these are certain things that, we have to know regarding, the hair or the skin actually. Then we also have some kind of changes which happen as one ages. Yes, one of them, yes, one may be susceptible to injuries and infections because the immune system actually reduces in there, the immune cells reduces. Then there will be, sun exposure by way of the hyperpigmentation, the melanin protecting you, yes, also comes down. Everything tends to come down. The skin becomes dry and of course scaly. Then the hair becomes thin and of course graying actually happens. Yes, in British English supposed to be E, graying happens. The skin tends to sag, yes, wrinkling occurs. Heat loss, decreases actually. Then of course, repair also slows. So everything, slows because blood vessels, whatever, certain things, mechanism which is actually taking place to protect the individual by way of the skin doing that, then everything tends to, diminish. So let's look at the skin developmentally. How does the skin, arise? So one thing that you should know is that the skin, okay, is having epidermis and dermis. Now, the epidermal component is actually coming from what we call the surface ectoderm. The epidermal component is actually coming from surface ectoderm, while the dermis, which is of course is the connective tissue component, is coming from of course the mesoderm. Okay, so that is what you have to know. But one thing is that around that, this one is actually happening around the 4th week of intrauterine life. 4 to 5 weeks of intrauterine life, we tend to see this single surface ectoderm, which is found superior or overlying what you call this mesodermal layer. Okay, so that is what we tend to see. Now, one thing that we have to know is that this kind of surface epidermal cells begins to proliferate. Now, let me just say that now this surface ectodermal cells, okay, will more or less like serve as the germinative layer. Okay, so that any other cell which will be coming from the epidermis will arise from this surface ectoderm. So it begins proliferate, and then it's of course it differentiate to give us what we call the periderm. And this periderm, actually is the squamous cells, which is going to be, of course, the most superficial layer, okay, of the epidermis. And that is what we call the, periderm. So that's the periderm. And of course, we also have what we call the basal layer. So upon mitotic division, the basal layer will give rise to, of course, the periderm. Okay, so this is what we are saying. We are saying that the embryonic skin around week 4 to 5, yes, will consist of a single layer of ectoderm, and beneath it will be the mesenchyme. The mesenchyme is actually the mesoderm, the connective tissue part. And then we said that these ectodermal cells will proliferate, of course, and it will differentiate to give us what we call the periderm, which is the superficial most layer. Then deep to that will be the basal layer, and that one be the germinative layer. Okay, and that eventually becomes the stratum germinativum, or you see that the basal layer. You see that. Now, what do we see? What we find is that the periderm, will undergo what we call keratinization and, of course, desquamization. Okay, and when that happens, they will be replaced by that kind of mitotic activity of cells that is taking place within what we call the basal layer. Okay, that's what we are going to see. So what we are saying that the cells of the periderm will undergo keratinization and desquamization. Okay, and then they move apically, and what will happen is that they will be replaced by the mitotic activity which is taking place in the basal layer. Okay, so what are we saying? In the periderm, okay, those cells which have been which have undergone desquamization will become what we call the exfoliated, peridermal cells, and they will form part of this kind of white grayish, substance that we find on the fetus and immediately postpartum. And according to WHO, you are supposed to leave this for up to about 24 hours, at least. Sorry, at most 24 hours, at least some 4 hours you should be there. That one is what we call venous caseosa. Caseating has to do with that kind of whitish something. So the venous, caseosa, okay, will be, covering the skin of the fetus, because that kind of exfoliated peridermal cells, okay, or that those cells which underwent, desquamization, okay, will form part of this, venous caseosa. Okay, but even apart from that, what we should know is that locally, at some point, these epithelial cells will begin to proliferate and grow downwards towards the connective tissue area. And when they do that, they form glands. They will form the sebaceous gland. They will form the sweat glands as well. So these are, the things that we tend to actually see. Okay, so what we see is that the venous is going to be very important in protecting the skin from constant exposure to the amniotic fluid, okay, with its urine content, because in the amniotic fluid there will be urine in there, so kind of giving that kind of protection to it. Apart from that, it also facilitates, birth, because it's quite slippery. Okay, so because of the slippery nature of the venous caseosa, okay, it will also help in that kind of slippery. So that is the development of the skin. The skin is coming from epidermis, okay, being the epithelial layer, okay, so it's coming from the surface ectoderm, the dermis connective tissue layer, okay, coming from mesoderm or mesenchyme, okay, then of course the surface ectoderm will proliferate or differentiate into what we call periderm, and of course the basal layer being the germinative layer. Periderm will also undergo some kind of keratinization and of course exfoliation, okay, and it forms part of the caseosa, venous caseosa, okay, that's what we find. And one thing is that locally, what is going to happen is that these exfoliated cells will be, periderm cells will be replaced by the mitotic activities happening in the what we call the basal layer. And what we find is that locally, these epithelial cells will tend to grow downwards towards the connective tissue area, and they will form what we call these kind of, glands, which will bear ducts. And that is what we call the development of the skin. Remember, happening around the 4th to 5th weeks of intrauterine life. So even apart from that, now we will get to know that in the dermis, okay, the dermis is connective tissue, so you have a lot of collagen fibers in there, collagen fibers in there, and the orientation of these fibers are very important. And those things are what you call Langer lines or the tension lines. Okay, so those lines, are very important, and they are very important so that, yes, for effective wound healing, then any cut should be done, along these Langer lines, because if you go against them, against the tension lines, then what will happen is that, yes, wound healing tends to be slow. I already told you about the epidermal ridges, which give that kind of contours, okay, of the underlying dermal papillae, okay, and will form the base of these kind of footprints and of course, fingerprints. And I told you that they will be important in gripping because they provide that kind of friction in there. Now, actually, if you want to study these epidermal ridges, the fingerprints, footprints, and what have you, looking at the various details of them, that's what we call dermatoglyphs. Okay, dermatoglyphs. So, what I told you that the main component of the integumentary system is the skin. But apart from the skin, there are some kind of, derivatives or modifications of the skin. And they are what we call the appendages, okay, of the skin. And in humans, we've seen the hair, we've seen the sebaceous glands or the oil glands, we also seen the sweat glands. Then apart from that, the sweat glands will be modified, okay, to become what we call mammary glands, okay, of the breast to make milk. Apart from that, even the external ear, we have what we call ceruminous glands over there are modified apocrine sweat glands, and they will be secreting this kind of cerumen, that is wax, ear wax. Okay, but in other animals, we tend to see feathers, scales, quills, even human beings, we see nails. Yes, we talk about that. Claws, hoofs, beaks, horns, antlers. These are examples of what we call, derivatives of the skin. Remember, they are all coming from the epidermis, but they grow towards the connective tissue area. So, what have we seen? We've seen that the skin is actually made up of, yes, epidermis, dermis. The hypodermis, or the subcutaneous tissue, is not technically part of the skin. Then we said that the epidermis will be made up of 4 or 5 layers. Then beneath that we have what we call the dermis, which is made up of 2 layers. Okay, we said that we are going to have these appendages. So these are the glands. So locally they tend to grow downwards, and this is the sweat gland. Okay, these are the sebaceous glands. These are the hair follicles over there. The hair follicle often, yes, frequently, almost always associated with this erector pili muscle. And then apart from that, we're also going to have some kind of immune cells, okay, by way of Langerhans cells in the skin. But even apart from that, we said that we're going to have some kind of sensory, modified sensory neurons in there. And these ones will be, of course, the Pacinian, having this kind of onion shape appearance. We also have those ones which are very close. Okay, very close in there will be, of course, the Mercinus corpus, very close to the Dermal Papillae. Will be the Mercinus corpuscle. We also have that kind of free nerve endings. Nociceptors will contain nociceptors and all that. So these are the things. We said that the hypodermis will be made up of what we call adipose tissue. So these are the things that we have to know. So taking a closer view, now looking at it, from a histological point of view, artistic viewpoint, then you will see that the epidermis will be made up of stratum corneum. You will see that stratum spinosum, stratum basale. We are actually going to see that kind of 4 or 5 layers. Yes, stratum corneum, stratum lucidum in case of what we call thick skin. Then of course stratum granulosum, stratum spinosum, stratum basale, will be mainly associated with the melanocytes. We will see that. And then we will see that in the stratum spinosum, you see the Langerhans cells often associated with it. Then these are the erector pili muscles, which are associated with the hair follicles. These are the sebaceous glands, being made up of simple branched alveolar glands. Then the hair, that the sweat glands will be made up of simple branch tubular glands. Will be simple branch tubular glands. These are the Pacinian corpuscles that I was talking about, okay, in the dermis. These are the hair follicles, okay, which we've seen. We are going to go into all these details, in our next section. Yes, of course, beneath that we are going to have, some kind of muscles in there. So these are the various components of the hair, or the integumentary system that we actually looked at. All right, so I'm very grateful for your time this evening. Have a good night. We will go through the other ones, okay, in our later section. Have a good night, and may God richly bless you.